A major leap forward for healthcare in the country as national health insurance is launched. Good evening, everyone. I'm Keishel Adderley.
And good evening, Bahamas. I'm Altaviz Mannings. Thanks so much for tuning in tonight. A promise fulfilled by the Christie administration as enrollment for national health insurance began today across the capital. This step will ensure that all Bahamians have access to quality health care.
Now, those registering today should be able to utilize the service as early as next month. And as Clint Watson tells us tonight, the nation's chief was among those taking advantage of early enrollment.
Prime Minister the Honorable Perry Christie says national health insurance is hailed as the most significant event taking place in the history of the Bahamas.
I've seen friends who, but for not being able to meet the cost of health care, suffer unduly.
The nation's leader has been a driving force behind its implementation, as N.H.I will no doubt be credited as a legacy of the Christie administration. On Monday, that dream became reality as Mr. Christie began the process of signing up for primary health care under the plan. Showing up with his NIB card, the Prime Minister was taken through the steps of registering and almost completed the process until he discovered that he wasn't prepared to select his primary care provider from the approved list. After the N.H.I team explained the importance of choosing a primary care provider at the onset, he vowed to return to complete the process. Mr. Christie explained that he wanted more time to consult on who he would choose. Speaking to reporters afterwards, he says the purpose of N.H.I helps those faced with a choice of life or death to now have a chance to live, even though before now they couldn't afford it.
Overall intention of national health insurance is to provide a different kind of environment for patient care. Smaller rooms, say 4 patients to a room, better accommodation, greater access to medical care, and most certainly getting the same access that those who were able to pay virtually would get, because we do have a system where the consultants and specialists are able to access such patients.
The Prime Minister says today is significant for Bahamians everywhere.
Bahamians have been reaching out to me to tell me what this means to them personally. This is just the beginning. My government is committed to ensuring that every Bahamian on every island has the health care they need. And my government will carry this change forward. And we cannot afford to stop our progress now.
But N.H.I enrollment won't alone address the medical issues in the country.
There will have to be parallel programs taken on both by the educational system and our school children, by the adult population of the Bahamas, towards being better prepared in taking care of ourselves to avoid the health challenges that we continue to have.
Enrollment can also take place online. It's important to note, though, that you will need to select a doctor from the authorized list, which changes daily. Clint Watson, ZNS Network News.
Thanks, Clint. Well, Carla Palmer has more from the team responsible for national health insurance, saying its rollout should be good news for the thousands of Bahamians who currently don't have medical coverage.
As soon as the doors to the Enoch Beckford Memorial Auditorium on Carmichael Road opened at 9 a.m., residents were filing through in steady numbers to enroll in the National Health Insurance Program. This phase 2 of the scheme is focused on residents selecting a doctor of their choice. By noon, project manager of N.H.I, Dr. DeLon Brennan, says over 350 persons had enrolled at the 3 centers, including Cotton Tree Plaza on Burnett Road in Fox Hill and New Providence Community Center on Blake Road. He says persons can also enroll online at nhi.gov.bs and connect to the link.
You must have your NIB Smart Card to enroll, be a Bahamian citizen or legal resident, and have proof of residency in the Bahamas for the past 6 months. Some persons who enroll online may need to bring documentation in person in order to prove their residency information.
Permanent Secretary with National Health Insurance, Mr. Peter DeVoe Isaacs, says just over 60 doctors have signed up as providers, with the number increasing each day.
This will be further augmented by by primary care providers in the public sector, the Department of Public Health, and the Public Hospitals Authority. Persons on the Family Islands can enroll in person at their local NIB offices.
While enrollment is not mandatory, Dr. Brennan says the benefits of free primary health care far outweigh the disadvantages.
Remember that those with existing health insurance can keep their private coverage as a top-up to N.H.I. Bahamas. But you must provide the name of your insurance company as well as your group ID and member number on the enrollment form for benefits coordination purposes.
At the end of this month, N.H.I. officials say registration will open for residents to choose their diagnostic and pharmacy providers. Carla Palmer, ZNS Network News.